coming in with adult female acne. And I think it's extremely distressing to people who thought that this was something that was going to be in the past. When you're trying to go to like lead a meeting at work and your face is full of acne and you're 35 years old, it's like what the hell is going on here? And
Yeah.
like this should not be happening, right?
Welcome to the More Than a Pretty Face podcast, where we go more than skin deep to explore the science of beauty so you can feel your best at any age. I'm Dr. Azadeh Shirazi, a board-certified dermatologist and host of the More Than a Pretty Face podcast. I'm so excited to welcome Dr. Evan Rieder, who is both a dermatologist and a psychiatrist. He is one of 3 physicians double boarded in both of these specialties, so it is such a privilege to have him on the show. As he puts it, he is blending the artistry of a dermatologist with the understanding of a psychiatrist. He is a sought-after expert in the world of beauty, mental health, and well-being. Help me welcome Dr. Evan Rieder. Hi, Dr. Rieder. How are you?
Hi, Ozzy. Thanks for having me today. I guess I put it that way, that I artistry of a dermatologist and understanding of a psychiatrist. And I try to stay true to that in my interactions with patients and hopefully with my colleagues as well.
Yeah, I love that because if you really think about it, beauty and mental well being really go hand in hand. But I feel like in today's society, they can also clash and, have one of an antagonistic sort of blend too. So it's almost like a double-edged sword. And we're hearing a lot obviously about mental health and how these images online on social media can really have a detrimental impact on our mental health. What exactly drew you to become a dermatologist and a psychiatrist?
I'll give you the short story because it's a long one. I think when I was a medical student, I tell everybody I actually hated medical school. I hated the first 2 years of medical school because it was like trying to memorize everything. And I studied the humanities in college. Just had to write papers, and I could do that, read and write papers. I could do that at the last minute. And then I was all of a sudden in class with all these like exceptional memorizers. So people who could listen to a lecture and absorb every single fact from there, or read a text one time and then like know every single fact they read. And that's not how I absorb information. So I found it to be pretty humiliating to be in med school, but I really liked being in my clinical rotations, which is the 3rd and 4th year of med school. And I thought that I was going to be a psychiatrist. I am still a psychiatrist, but I liked the intimate interaction you have with people. Obviously, you see people at very vulnerable moments in the medical um, units as well in the hospital. But when someone's in the throes of depression or a manic episode or a first break psychosis, or they've just relapsed on alcohol and drugs, that can be pretty profound. They can be really in like a terrible place. And I felt that everybody's situation was different. Everyone's background was different. Everyone's story was different. So there was no cookie cutter approach to it. And I felt that most of medicine was pretty algorithmic, and I still think it is. But then I did a rotation in dermatology. I remember when I was already pretty much decided on applying to psychiatry residency, and I really liked it. I liked you can make the quick diagnosis, and I liked that you can work with kids and adults and do surgery and cosmetics and medicine. And then I remember rotating through a connective tissue disorders clinic. So I'm not sure if you're probably don't practice too much in that sphere anymore, and I don't really do too much in that sphere anymore either. But people who have joint diseases and skin diseases, and sometimes the skin doesn't look so bad, but the joints are like completely flaring up, and I felt like I was rotating through a psychiatry clinic, and people were getting really good skincare, but there was tons of depression and tons of anxiety. And I was like, what's going on here? This is all being ignored. Like no one's talking about these people's suffering on like the psychological level. So at that point, I started reading about it, and I was like, I might try to do both. And people were like, that sounds crazy. That doesn't make sense. And that's not even possible. And then when someone tells me that I can't do something, then I really want to do it. So that was like, that was sort of when it started. Yeah, that's the short story.
Yeah, I mean, unlike, internal diseases, when somebody is suffering with a skin disease, it's out there. It is on display.
Mhm.
Your condition is there for everybody to see it, to judge it, to view it. So it can take a detrimental toll on the patient's well-being. And I think it's so important that all of us, are are somewhat a little bit of a psychiatrist when dealing with patients in medicine, because
Hmm.
I share your view of, treating the whole patient holistically rather than just their condition, right? And so you're very vocal when it comes to encouraging doctors to advocate for their patients. Was this inspired from your psychiatry rotation and background?
I think so, and I think that you sort of hit the nail on the head. What talking about things holistically. There's a lot. I practice a lot of cosmetic dermatology, and I think you do as well. And I think that there is a tendency among a lot of people in dermatology to focus in on one area, and I think that when people are only focusing on cosmetic dermatology, they're losing a lot of the other part of the story. They're losing what separates us from nurses or injectors, like cosmetic injectors, who may not be trained in medicine or may not be trained in dermatology. And like, there's often that something goes wrong and you need to understand what's going on psychologically or medically with your patient. So yeah, I think that that holistic aspect is what I've been thinking about. And I think you also said something that was really nice. When your skin is flared up, everybody knows it. It hits you on a very deep psychological level, and I think everybody has felt that way because we've all had acne. And for some people, having a face full of acne is uh, enough to make them stay in the house and not going to not want to socialize and not want to go to work. But some people have one or two acne bumps, and that's the same impact on them. So everybody's set point is different, but the skin disease affects us in lots of different ways, and it also affects the way that the public and like our peers interact with us, whether that's fair or not. We now have the data to prove that.
So tell me a little bit about that. You said you have the data to prove that. Was there a study that was done on that, or?
Yeah, there's been several studies, especially like in the there's been some interesting studies in the cosmetic literature showing that your first impressions are really important, and that becomes very important in especially in the world of dating and the world of business. People make split-second judgments about you, whether they know it or not. They're happening on an unconscious level, and that's happening to you. If you have skin disease, people are there's something coming into their head as this person, especially conditions like eczema and psoriasis and acne, all these severe inflammatory disorders that can affect the face, that can be difficult to treat, especially without the help of a board certified dermatologist. People make snap reactions unconsciously, and that's part of like our sort of unconscious bias that comes into play. Same thing happens. We know that our first impressions can be changed by people who get very tasteful cosmetic procedures done. So people who are getting Botox regularly or people who are getting filler in the hands of an expert can actually change the first impressions of people that they're interacting with. And again, then that becomes very important in the world of dating and socializing and the world of looking for a job. And especially when people are, we're all aging, and I think a lot of us in dermatology are trying to fight that as our patients are trying to fight that, and we're trying to do it as gracefully as possible. But there's always someone younger and more attractive and having more energy than you. And so I think that we know now that the cosmetic procedures can actually help that as
Yeah,
well.
absolutely. So I was reading the other day about how when, we look at ourselves in the mirror, obviously on a regular basis, and that image becomes so familiar to us, and that's the image sort of we like to see, that's appealing to us. But when we see ourselves like on a video or on a photograph, that image is somewhat skewed to us. It's not as attractive or as appealing to us as our image in the mirror. Is that something that you've run across or have anything to any comment on?
For sure. I think we've seen that the most with these web applications like the one we're using now, and I can make myself look. We're video recording this as well, so people can see video or just audio.
Yes, yeah, no, we
Okay.
have the video too.
So all right. So like if I do this, right? It's like a much more unattractive view of myself. And so it's like on a basic level, just by thinking about where the focus is on your lens and where the shadows are, you can generate an image of yourself that's very unattractive. And I think a lot of people were seeing that, and people talked about like this Zoom dysphoria concept. And I think that concept is problematic.
Mhm.
And we have talked about it ad nauseum with my patients and the media over the last couple of years. But that's a real phenomenon. But I think that what happens is that these images start to get like you said, sort of the more you see it, the more they become like imprinted in your brain, and the more you have an unrealistic expectation or an unrealistic vision of what you actually look like. Because I know I don't look like this, and I actually hold my head back this way when I'm looking at a camera because I know that's going to make my folds look better. And if I do that, I look worse. So that's really like on a basic, like, logical, not emotional level that happens. But then that ends up spurning people like emotionally, and then they start looking for things that they can do to improve their appearance, and they get involved in social media, and then they start looking at rapid fire imagery, and then we have a problem because we know that like our views of ourselves and our views of beauty are not static, and they can be changed actually pretty quickly, and the social media apps are a really efficient way to do that.
Yeah, I agree. How interesting. I didn't really think about that until I, came across of that. So you've authored a book called Essential Psychiatry for the Aesthetic Practitioner, and you talk about helping aesthetic practitioner identify and manage psychological conditions, and that includes, obsessive compulsive disorder as well as body dysmorphic disorder. What makes a patient a good candidate for a cosmetic procedure? And on the other hand, what are some red flags that practitioners should look out for?
Yeah, I think this is such an important topic, and I think this is something that gets missed all the time. And it's one of the topics that nobody wants to hear about. The general public may want to hear more about this than we do as dermatologists and plastic surgeons, but um, I think that we all have something that we don't like about our bodies. Some of us have many different things that we like about our bodies. Even the people who we think look the most perfect in the world have things that they don't like about themselves. And it's so normalized in the general population that there's a term for it that was coined in the psychological literature, called normative discontent, and that originally came into the literature in the 1980s, and that was originally used to talk about women and the way that they felt about their own bodies, and there are so many people who feel badly about themselves that it's been normalized. That's since been like proven in the male population as well, but that's why that people like us have a job, right? That's why people come in to get cosmetic procedures done. And I'm always honest with people. I get my own cosmetic procedures done as well, and they help me feel better about myself, right? So that's okay. And normative discontent is okay, and it's normal, right? But we get concerned with body image issues when people look really good or they look really normal, and they come in to see us asking for something that makes us be like, what are you talking about? Like they may say, I'm losing my hair, and their hair looks perfect. Or they say, my nose is too big, and you don't know what they're talking about. Or they'll show you something in a picture and you don't really see what they're talking about, or it's really, really minor. Then your antenna should go up, and you should think about, "Ooh, does this person like processing visual information different than the rest of us? Does this person have a body image disorder?" And when those people are spending a lot of hours each day thinking about that, like more than an hour, thinking about something that you can't see as a cosmetic dermatologist or a nurse injector or whatever you are in the field of aesthetics, or your friend is talking about something like that, and you're looking at them and you're like, what are you talking about? Like, you have beautiful skin or you have beautiful nose, there's nothing there. Then you should be concerned, right? And those people end up being very bad candidates for cosmetic procedures. I see them all the time because I plastic surgeons will send them to me if someone wants to get a rhinoplasty done, and they'll be like, something's off about this person. I'm not sure they're seeing what I'm seeing, or I'm concerned they may have body dysmorphic disorder. And I think it's really important for us, not only to our patients, to prevent them from getting procedures, but to protect ourselves. People with body dysmorphic disorder are universally unhappy with the results of cosmetic procedures. They have high rates of all sorts of psychiatric disease, depression, anxiety, obsessive compulsive disorder, and substance use disorders, and really high rates of suicidal thinking and suicide attempt.
Mm.
And I think that's what I would think of. I think when people use the term body dysmorphic disorder, body dysmorphia, it's all over social media now. People don't know what they're talking about. You can't make that diagnosis without talking to somebody and understanding what's going through their mind, and how much time of their each day that they're using thinking about their appearance or doing something to fix their appearance. And these people look normal or they look really good. I think that's the biggest take home point, normal looking people.
We have the most amazing podcast community, and we want to thank you for being such a loyal listener. To thank you for being a fan of the show, we want to extend a 15% offer exclusively to podcast listeners. Use code April15, APRIL15 at Aussie MD Skincare, April 15 for 15% off. This is a special discount code we're only giving to our podcast listeners. Don't forget to tag me in your skincare selfies. I love to see you glow. So, what are like some of the top 3 questions you would, right off the bat, sort of ask them in that evaluation for?
Yeah. Um, well, first, I think if you're working in the field of aesthetics, I would urge you to think about this. I would urge you to read about this and think about this. Something is like an algorithm that you just go down and take the fear out of it, take the anxiety out of it, and then it becomes much more easy to ask these questions. It becomes boilerplate, and it can become interesting and not um, fear provoking for you. So I ask people, is there something? And these questions are part of a document called the BDDQ, the Body Dysmorphic Disorder Questionnaire. There's one that called the dermatology version, and I think you can access it online. It's written by Kathy Phillips. She's one of the authors, and it's from the year 2001, I believe. And so I asked, is there something about your appearance that you find to be particularly unattractive? Right, that's the first question I ask, and most people will be like, "What are you talking about?" Like, no, or like, "Oh yeah, my nose is like not great, but like whatever. Like I don't, it's not bothering me that much. Like I have." I go on with my life as normal. And if they say yes, then I say, how much time a day you do you spend thinking about this? And that is actually that gives you a lot of information right there. And if people are like, oh yeah, just like I look in the mirror and I don't like what I see in the mirror, and then I go to work and it's no big deal. But if people are like, I'm spending an hour or more a day, then you should be concerned. And then you shouldn't go down the road of doing a cosmetic procedure. Um, I think those are the two most important questions. There's a laundry list of other BDD questions you can ask, and the goal is not to turn everybody into a BDD expert; is to be able to recognize it, so you can protect your patients from getting procedures done, and you can protect yourselves, because the rates of litigation against cosmetic providers is also it's pretty high. Even when
Yeah.
you give someone like an amazing result, I saw someone last week, he was showing me before and after, and he's like guy ruined my nose, and I like literally couldn't see what he was talking about. And he had seen a pretty prominent plastic surgeon from LA, and he was flying all over the country to see people. And it can really lead to it can lead to a very bad place for patient and practitioner alike.
Yeah, I think that is a very difficult case, when you have someone like that. In your opinion, what is the most difficult diagnosis to treat as a dermatologist and a psychiatrist? I mean, we talked a lot about obviously body dysmorphic disorder is certainly up there, but are there other very
Yeah.
difficult?
Um, that's a bad one. And then I think anything where there's no insight on the part of the patient, meaning the patients don't have any understanding of what's going on of their disease. So that's a disorder where people think that there's something going on with their appearance, but really there's something going on in their brain and in the way that they process visual
In their
information. And whereas the
perception.
world sees
Yeah.
them as beautiful. What's that?
In their perception, there's a, is
Yeah, exactly.
disconnect there.
It, yeah, the world sees them as beautiful, and they see themselves as horribly unattractive. The other condition that I don't see that much of anymore, and I used to see when I was at NYU, is like delusional disorders, when people believe that they're infected with organisms, bugs, fibers, and really what's happening is usually we find that there's something going on with the way that they're perceiving their environment and not in the actual infectious disease. And those are really hard because people are locked in the way that they think about things, and there's nothing you can do to shake them out of it. So this delusional thinking. Um, and that's very frustrating. People are upset. People can be angry. People can call you names and storm out of the office. And even when you give them the information that can actually help them, they don't want to hear it.
Mhm.
And that can be really tough.
Yeah, poor prognosis for that. Well, I've been loving all the video content that you're putting out on your social channels. So thank you for your valuable time in doing that. One of your most recent videos, you mentioned that we are undergoing an adult female acne epidemic. And, I was thinking to myself, I could see that. Can you tell us a little bit about what that means and Just talk a little bit about that.
Yeah, I think that I don't think everyone totally understands why that's happening, but there's a lot of people who should have, I would say in quotes, like aged out of acne. They were coming in with new onset acne or a recrudescence of their acne that was quiet, or acne that they've had since the age of 16 and has never gone away. And they're coming in at age 30, 35, 40. I don't see too many people in their 50s with new onset acne, but I do see it. And I think that that was a phenomenon that we weren't seeing like before I was practicing dermatology. Were you seeing
Yeah, I
that at
mean,
all? Like in the
yeah, I
last
would
couple of
say
years?
probably in the last 10 years. And I don't know if it's diet related. I don't know if it's the past few years, skincare
Hmm.
has really blown up and people have forgotten that that the skin
Hmm.
is an organ and you can't just, pile on all these different products. We've sort of become these over consumers of products and skincare routines. I'm trying to think of what could be contributing to that.
Yeah, I think that there's must be a lot of different things that are happening, right? I think the concept of like overuse of skincare is an interesting one. I do think skincare, the phenomenon of like skincare use is an interesting one just from a population perspective, like young kids are into it. And we do know acne is a disorder of the epidermal barrier. So if you're using like, inert skincare that you would get in the drugstore, you would think that this would be something that would be helpful for other people. But, I think that there is a shift in hormones that happens when people age, especially women. There's some like a higher predominance of the male hormones. There's more testosterone to estrogen ratio. Maybe that's playing a role. Maybe there's some environmental exposures that are happening. How much does climate change play into this? How much does pollution play a role in like cities? We both practice in cities, but are they seeing the same phenomenon
Yeah.
in rural Iowa? I don't know, where people are in farming country. Um, and Yeah, but the skincare piece is an interesting one. But there's so many different things that go into the reason that people get acne. It's hard to pin it down. But I think the phenomenon is not I mean, it's there. We're seeing a lot more people coming in with adult female acne, and I think it's extremely distressing to people who thought that this was something that was going to be in the past. And I always tell people that I think about acne as like the classic triple threat. It's like a medical condition, but it's also a psychological condition and it's an aesthetic condition. And when you're trying to go to like lead a meeting at work and your face is full of acne and you're 35 years old, it's like what the hell is going on here? And
Yeah.
like this should not be happening, right?
I know. Yeah. I mean, you would expect to outgrow it. And that's what a lot of the women that come in tell me. They're like, why do I still have this? Do you have a hormonal workup that you do when you see these patients or um, i- any particular sort of treatment or algorithm you follow?
Yeah, I mean, I don't know what you do, but I very rarely end up doing a hormonal workup. I do a hormonal workup when people have tried a million different things that are, dermatologist prescription based, dermatologist prescribed, like antibiotics, spironolactone, isotretinoin, even acne lasers, and they're just not responding to anything. Then I'll do a hormonal workup. Or if they have, sort of hair growth and patterns that men normally have it, right? So if they're bald on the top of their head and they have lower face hair, or there's periods irregular, those are times when I do a hormonal workup. But I think a lot of people are sort of into that concept. I need to get my hormones checked because I have hormonal acne. And that may be something you see more in the West Coast than we see in New York. I'd be sort of interested to hear about that.
Yeah, I mean, I just ask them about their periods because to me, if they have regular periods, it's highly, highly unlikely that their hormones are,
Hmm.
imbalanced. But measuring hormones, as you know, is not easy. It's different for everybody. It cycles almost
Hmm.
throughout the day. I mean, forget just different times of the
Yeah.
month, but there's no set sort of guideline or normal levels. It's kind of like a range and can be different for everybody. So it is it can be a difficult condition to deal with. But I feel like we've got really good treatments. I have really great results with spironolactone, and we're also doing AviClear laser in our office.
Hmm.
I don't know if that's anything
Hmm.
you've had your hands on or not.
Yeah, we have it too.
Yeah, what have been your experience
I
with
I
that?
have some feelings about AviClear.
Yeah, tell us about
I,
it.
I use I use AviClear and it works for some people, but I think that AviClear does a very good job of marketing, and I think you need to read the research. Not you, but like one needs to read the research very closely because for a lot of people who respond to AviClear, it doesn't happen very quickly,
Mm.
right? It could happen months after the last treatment. And I think that I have a lot of people coming in, they want to get better now. So often when we put people on AviClear, they're still on some sort of topical and sometimes even an oral regimen too. That's a bridge to to getting to where they need to be. There's people who are 6 months out of AviClear who still have enough acne they could re-enter the trial to go back into the AviClear trial because it's I still don't think it's as good as spironolactone or isotretinoin, but for some people it's great. And a lot of people who are teenagers who like can't or won't use acne medications or like the regimen's too complicated or people's skin is sensitive, it's a really nice option to have.
Yeah, I agree.
What's your experience been like?
Yeah, same. I think it takes 3 to 6 months to really see clearance, and sometimes 9 months.
Hmm.
And it works really great in some people, and then it also can cause purging, which can
Hmm.
be hard to manage as well. And I have some patients who really thrilled with it, others that I wish I would have chosen Accutane, from the start.
Yeah.
So it's
Yeah.
but it's an option for somebody who doesn't really want to go to Accutane or wants to do a
For
laser.
sure. But I also think it's like that's why as like a consumer, it's really important to think about who you're going to your treatments for. Because if you go to like a spa where all they have is AviClear and they don't have a dermatologist, guess what? You're getting AviClear, right? And that may not be
Yeah,
the best thing for you. And so I think you need to have someone who can go through the science and the data with you and give you the risks and benefits of everything and have everything at their disposal to make the
yeah,
right
I
decision
agree.
for you.
Yeah, and then if you do have a complication, with AviClear, they can manage it. Like if you have purging or,
Totally. Yeah.
so, but I've also used
Yeah.
it. Yeah.
Yeah. Complications.
I've also used it for patients who undergo, rhinoplasty, and they get this kind of rebound hyper oil secretion in the nose, and they've done well with it too. So I
Oh,
think maybe
interesting.
we'll see
How
some
long?
other,
Yeah.
yeah. How long?
No, I was just wondering how long does that usually take for people to respond to the oily skin thing?
I would say after probably a couple of months, probably after maybe their second or third session.
Hmm.
There is definitely a delay. I
Hmm.
think it takes some time for those oil glands to, become less active. It doesn't happen,
Yeah.
instantaneously as they may make it out
Hmm.
to be. So I know you have a busy day ahead of you, and I know you have to run. But before we go, I wanted to play a game. If you have a
Yeah. Let's
moment,
do it.
it's called Slay or
Okay.
Nay, and you tell me if you love it with a sleigh or if you don't, a
Let
nay.
me tell you first.
So
Let me tell
number
you first.
one,
I've never said the
yeah.
word slay before in my life, so this is going to be a first.
Uh, there's a first for
Yeah.
everything. We got Dr. Reader's first sleigh on the More Than a Pretty Face podcast. So that I love it. So number one, antioxidants.
Slay.
Powder brush SPF.
Slay.
PRP for hair loss.
Uh, ooh, I have to pick one. I would say slay.
Slay. Why did you hesitate?
Because data for PRP is mixed, and I get better results doing other things. But yeah, for some people, it works really well.
I almost never solely do PRP. I always do medical therapy.
Me too. Yeah.
So, AviClear acne laser.
Same thing. I'm like on the fence there. I will say slay in the in the right patient.
Microneedling.
Microneedling alone or microneedling with radio frequency?
Well, we'll do both. Microneedling
Okay.
alone.
And I suppose it depends on what condition. Microneedling for like scarring and texture, slay. Microneedling with radio frequency, for most things, a nay.
I agree. I don't like them combined together. Going to therapy.
Slay. For sure.
Yes. I think everybody could benefit from therapy. Well, thank you so much, Dr. Reeder, for being with us today. I learned so much from you, and you always have such great insight. And keep putting out those videos. I love what you're putting out on social. So tell everybody where they can find you. I know you're based out of New York, right? You're in the city?
I am in the city. I'm in Soho at 155 Spring Street. And you can find me online at Dr. Evan Rieder, DREVANRIEDER.com, or that's my Instagram hashtag and that's my TikTok as well. Thanks so much for having me today.
All right. Thank you so much.